Well, hello there, Sleeping Beauty. I thought you were never going to wake up. Hi, my name is Dr. Wazowski. I'm going to assume that you don't exactly remember what just happened, so allow me to give you a little bit of a play-by-play. Let's see, about 6:52 p.m., paramedics received a 911 call that you had fainted dead cold at a steakhouse at what appeared to be your grandma's birthday party. Blood tests were taken to reveal that your blood sugar levels were very, very low. And further medical history examination revealed that just a few months prior, you had taken a glucose tolerance test to reveal that you had type 2 diabetes. And according to even more medical charts, you haven't been managing it very well. Now, I'm going to cut you a little bit of slack here since this is a new diagnosis and everything's still getting sorted out. And I'm going to educate you on your condition of type 2 diabetes and how to treat it properly. Type 2 diabetes is a condition where your body's blood sugar levels are naturally much higher than normal. This is due to the fact that the body resists the hormone insulin, which is secreted by the pancreas and regulates the absorption of blood glucose into the blood cells and increases the production of the storage carbohydrate glycogen. When the body resists insulin, the cells are unable to attain the nutrients they need, and there is an overabundance of glucose in the blood as a result. This results in stress to the body in multiple ways, symptoms you have likely experienced prior to your diagnosis. First is polyuria, which is the production of large amounts of urine. Large amounts of urine are present in an uncontrolled diabetic because of all the glucose from food consumed trying so hard to be filtered into the cells. The cells have lots of co-transporters to help with glucose absorption, but since insulin resistance is at play here, there's just too much glucose to be filtered and transported, and the co-transporters are all filled, and this is known as transport maximum. Thus, more urine is produced to rid the body of the rest of the glucose. This results in polydipsia, or a great thirst, to make up for the massive loss of water and glucose that is the diabetic urine resulting. Also, since the cells are absorbing significantly less glucose, polyphagia, or great hunger, will occur in an attempt to make the diabetic patient eat more in an attempt to build blood glucose levels back up to normal. Evidently, this cannot be allowed to go on, so there are many treatment options available. Insulin therapy is a popular choice, especially a drug called metformin for type 2 diabetics. Metformin improves the sensitivity of the blood tissues to insulin, allowing for better blood glucose absorption. Drugs known as sulfonylureas and meglinotides simply work also to increase the levels of insulin in the blood, making resistance harder. Other treatment methods include healthy eating and exercise, such as obesity is one of the leading causes of type 2 diabetes in addition to a sedentary lifestyle. And of course, blood sugar monitoring to see any changes and know when medication or hospital visits would be most appropriate. Obesity can lead to diabetes due to the increased amount of macrophages corresponding to an increased body weight, resulting in an increased occurrence of inflammation, especially in the liver, which stimulates insulin resistance and the production of less insulin by the pancreas. Now, since you may know, if you do not go about recognizing and treating diabetes properly, diabetic shock can result. Diabetic shock occurs for a few reasons, the main ones being skipping food with an insulin injection or injecting too much insulin. The high body insulin levels resulting from either can lower the person's blood sugar dramatically, causing nausea, dizziness, and, as you see, fainting. A diabetic has to make sure they never drink alcohol without food, eat healthily and regularly, and be careful to inject the proper amount of insulin. In a normal patient in a glucose tolerance test for diagnosis, blood sugar levels are around 60 to 100 milligrams per deciliter, with a peak level of less than 140 milligrams per deciliter, and are regulated by insulin for 4 hours following ingestion of the glucose substance, known as the absorptive state. In a diabetic patient such as yourself, your uncontrolled blood glucose levels peak at 200 milligrams per deciliter, and take much, much longer to return to normal due to the insulin resistance. In addition, you must be even more careful because type 2 diabetes increases infection in the body by breaking down blood glucose and increases the work of beta defensins, which are slightly positively charged proteins that attack electronegative bacteria, bad or good. So it's always a good idea to go check out any kind of inflammation or infection for possibility of medical diagnosis and to prevent it from spreading. Well, I think I've said my spiel. Now, as you're recovering, I'm going to send in a dietitian to discuss proper eating habits and proper foods to maintain your type 2 diabetes in a safe and healthy way so you don't pass out at grandma's birthday dinner again. Remember, eating regularly is important to lose weight even, and is extremely important for diabetics. Be sure to monitor blood glucose levels regularly and get plenty of fiber through fruits and vegetables, as well as plenty of daily exercise. Anyway, it was great to meet you, and I hope your recovery is fast and safe.